Good afternoon, everyone, and thank you for joining us. This is Abby Schonecker, Marketing Specialist at Spok, and I'll be moderating today's webinar. Today, we will be talking about HIMSS18. Now that the biggest event in health IT is over, what did we learn from it? Spok Chief Nursing Officer, Dr. Natay Guyton, and Chief Medical Officer, Dr. Andrew Mellon, will be giving you their thoughts on the hot topics from the conference. Before we get started, I'd like to go over a few housekeeping items. Everyone will be muted during today's webinar, but we welcome your participation. Please submit your questions via the questions box in the GoToWebinar toolbar, and then Natay and Andrew will answer as many questions as time allows after the presentation. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow, so please feel free to share these with others at your organization. At the end of the webinar, you'll have the opportunity to complete an evaluation. We'd love it if you could take a couple of minutes to complete this survey. Your feedback helps our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Andrew, who will begin our presentation.
Thank you. It's great to be here today and to talk about HIMSS. HIMSS is one of my favorite times of the year. I've gone to, I think, 17 of them now. I've been there as a vendor. I've been as a person in the booth doing demos nonstop all day. I've presented, and I've been there as a health system employee. And I always leave it certainly exhilarated and my mind full of ideas and exhausted. And this year was really no different. A lot of great topics, and we'll walk through them today. So many things came out in the cloud today, and we'll touch on all these really at a fairly high level, but sharing some insights and stories that we heard. Certainly lots around interoperability and cloud and partnerships and cybersecurity, on and on and on. But it was, again, another HIMSS full of great ideas, really innovative technologies, and forward-looking thinkers. So I'm going to start with a quick live poll. We're going to talk about cybersecurity. What is the greatest concern about medical device security at your organization? Is it around patient safety, data breach, spread of malware to other devices on the same network, liability concerns, or intellectual property or device theft? So we'll just take a moment and let's see how you answer this. All right, we're getting in a bunch of answers here. Let's give it about 15 more seconds. All right, let's wrap this up and see the results. So first one is data breach. Certainly something we see in the headlines fairly frequently. Second thing is patient safety. We know how integral technology is today to providing safe and efficient patient care. And, having that compromise can lead to major impact. And then the third, we see a spread of malware. And certainly have seen malware such as ransomware and other things really be a problem in many health systems. So let's jump into some of our learning. And obviously cybersecurity is a big problem in today. And it's interesting, in this poll that HIMSS did related to cybersecurity, 75%, so 3/4 of health systems have experienced a significant security incident in the past year. That is unbelievable. I mean, 75% had something happen. And we know some of these are extremely serious. We've seen things where vendors have been attacked by ransomware, which brought down their entire community of users so they couldn't access their EHR or, what some other ones, some of the dictation and PACS systems. That's devastating to not have access to the information. We've seen patient information escape. I've heard numbers. I think the number I heard was about $50 per health, to buy someone's health system's record on the dark market or the dark web, compared to like $5 for just regular identity. So that health information is really valuable. And one of the interesting things I learned is the value for the health systems. You wonder, why is it so valuable? Well, people use that health record information for fraudulent claims against CMS. that's one way they use them. So they get their identifier information and maybe some conditions, and then create ways to submit fraudulent claims to get reimbursed for things, and then they just do it in a way where they hide their tracks and move on to something else. So while I think even I thought that the value of this was maybe for personal threats, it's really for financial reasons. They can use that information to make a lot of money off of it. And there was a cybersecurity command center there that's focused on these problems. It's really grown tremendously. And I did go to a couple talks actually on this topic, and a couple of my takeaways. One was a gentleman who was a hacker. He calls himself an ethical hacker, and he works at a cybersecurity organization now, helping health systems and other organizations. And he talked for about 45 minutes and basically said the same thing. Humans are the weakest link, and don't click on links in the email. So there are certainly plenty of things to do to keep your network secure. There are certainly, you need to keep all your patches up to date and have the right firewalls and perimeter monitoring. But your biggest weakness in every organization is the humans. And I looked at some statistics. This is from an organization that does phishing simulations. This was really fascinating. This organization in 2017 ran phishing simulation tests. So they sent out emails to people that could have been real phishing emails, but they did it, to 128 companies. This was about 126,000 total emails, so a pretty large number. But the statistics were kind of mind-boggling. So 48.2% were opened. So, okay, people opened the email just to see what it was. So that's okay. But 31.5% clicked the link. And we all know that clicking a link can lead you to sites that you don't think that they aren't what you think they are. They can install malware on your computer. So 31% of the time people clicked on a link in a phishing email, fake phishing email. And even worse, 7.2% actually entered information that they shouldn't have. So in this talk I went to, he showed forms, phishing forms, that looked identical to what you might receive from Microsoft or Apple or anybody that you use on a regular basis. And when you click on that link, they could just tweak one letter. So you might look at it, it might be APPLE or something like that. You don't notice it. And next thing you know, you're entering in your iCloud account or your Microsoft Office 365 credentials. And once those hackers get that first entry into your organization, it's all over. And they can remain hidden for a long, long time. The second talk I went to was actually from an FBI agent, and pretty interesting. But his biggest takeaway was, hey guys, we're here to help you. So if something happens, call your local FBI branch. They are prepared to help you with this. They understand the public sensitivity of this and will work with you to keep things private. This is something they don't want you to try to handle on your own, but to bring them in and they can help. So that was pretty interesting for me too. So cybersecurity, obviously a huge focus, and again, it's a human problem more than anything else, not a technology problem. Although there are obviously a lot of technology approaches to resolve it. All right, let's go to the next thing I want to talk about, which is the cloud. I've been seeing and hearing and talking about the cloud for years and years. My first product I worked on, which is now in 1999, was in the cloud, so this isn't new. But I think what's interesting now is a couple things. One is that these clouds are not simply ways to host devices anymore, or host software, but companies like Google and Microsoft and AWS provide you with a whole slew of toolkits and a whole ecosystem of services that help you deploy these things quickly, scalably. They help you so you don't have to build everything yourself. And it's just honestly cheaper and faster than it would be to do many of these things on premise. The other big thing about the cloud, and this was emphasized by Eric Schmidt in his keynote, is the scale that you get. You need scale that you get in the cloud to do things like build learning models for artificial intelligence, for machine learning. You need this kind of scale to do the massive data crunching that will help us understand how to cure patients, how to treat complex cancers, how to really help think and not just transact. And Eric Schmidt said, you know, I was here in 2008, in 2018, and I'm here 10 years later in 2018. We talked about a Dr. Liz, you know, sort of a doctor in the cloud. And he said by 2028, you know, if you invite me back at HIMSS to speak 10 years from now, I'll be here showing you Dr. Liz. So it's pretty cool. And we are definitely heading that way. But I think what's really fascinating about healthcare is this sort of still dichotomy between what we see in the consumer and general market and the way health system CIOs react. So we did a focus group with about 10 CIOs from health systems of different sizes across the country. And it's interesting, when we listen to their answers, they are not all ready to throw everything to the cloud at all. Some are a little more progressive in this focus group, but many of them really want this hybrid approach where core systems, PACS, maybe their EHR, their phone systems, maybe some of their alerting tools, they want to keep local, they want to have control over that, they don't see the value. Whereas others, maybe their Office 365, some with their EHR, some with, they talked about like a dictation system, are moving more to the cloud. And it's just fascinating when we've dissected their answers, though, there is a huge spectrum. Some people there are saying, nope, I want to do almost nothing in the cloud. Others there were saying, yeah, you know, we're probably doing most of it, everything we can in the cloud. So we are still very early in this transition in healthcare, but it is coming, and it does give tremendous benefits around being on the latest version, having vendors be able to push out updates without bringing down systems, you know, sharing, being able to have a place to scale at a very fast way. And I think ultimately, you know, 10 years from now, this won't even be a discussion anymore. This will just be the standard. I'll go to my last topic. Again, it's always fascinating to me to see all the press releases that come out every year, who's partnering with who. It's even more fascinating to see, sort of look back the following year to see which ones actually stuck. But what I'd like to talk about is just, you know, really one of the ones I think is really fascinating this year that was talked about was with OnScripts and Lyft. You know, what I see in healthcare today and what I see a number of organizations doing is really going outside the boundaries of what we would think them typically doing. So for example, Epic and Nuance partnering, that's pretty standard. But OnScripts is partnering with Lyft to build technologies where they can actually order Lyft services for patients who don't have access to rides right in the application and see the status of that. That's pretty clever. And you think about patient engagement, patient experience, making sure they get to their appointments on time, making sure they get to the follow-up. Seeing these vendors move beyond sort of their typical IT domain to thinking about how do we provide, and health systems for that matter, to how do we provide a whole package of services, whether they could be physical services like Lyft, to technology services to help do the right thing for our community of patients. So I thought that was one of the most interesting ones I saw this year, of how it's not just a lip service of saying, hey, you know, Lyft is offering rides to patients, but actually integrating technologies between the core EHR and Lyft to help do the right thing for patients. Now here at Spok, we also are continuing to expand our partnerships. I just want to touch on a couple that I think are going to be, that are really exciting for us. Some of these, like Blackbox, are helping us do some wireless assessments to make sure solutions are deployed. SpectraLink and Zebra, who we work very closely with, have great devices for using it to use in the hospital. Higher Ground, we use some of their technologies for call recording. But two that are newer for us and are adding, and we're already seeing a lot of traction with those, are QGenda. So QGenda has a very sophisticated on-call scheduling solution. It's really pretty fascinating how it works. They've built this tool where you put in preferences for physicians and dates they can work and can't work, and then there's a magic button you push and it creates a fair and equitable schedule. So a lot of sophisticated technology in there that we can now integrate into our on-call communication and collaboration tool and platform. Another one that we're really excited about is Bernoulli. Bernoulli has some very sophisticated tools to help with alarm management and help providers understand what's going on with patients and get early warning signs. So one of the examples I just want to show briefly is around telemetry alarm. So here in the world today, or with Bernoulli, when that alarm goes off and we receive that through Spok, we can then link it directly to Bernoulli's waveform viewer. So taking those actions and events that are happening, communicating through the Spok platform, and then through our partnership with Bernoulli, showing a whole set of rich information to the provider in one single workflow that lets them act on the information in ways they couldn't before. So this was a real live Bernoulli screen. It would actually show the waveforms moving, the heart rate and respiratory rate and other information being constantly updated. And again, it saves the provider the need to physically walk over to a screen on the unit, click on the patient, look at the alarm history, figure out what's going on. Now they can just do it right on their mobile device and act on it as they need to. So the partnerships will continue to grow, both at Spok and in the industry. And again, it's just fascinating for me to see how all these things are coming together through interoperability standards and through innovative ideas to help improve the experiences for the patient and the providers and caregivers. So with that, I'm going to turn this over to my colleague, Dr. Nate Guyton.
Thank you so much, Andrew. Very excited about that. So we're going to take a poll. And before we get started talking about patient engagement, this poll, it should be showing on the screen. Are patients using technology at your organization to support their experience? So yes, no, or not sure, and we'll give you a couple of seconds. Yes, so we see 57% says yes, 26% is saying no, and 17% is saying not sure. And that is rightfully aligned with what we saw, the trend at HIMSS. So thank you for being honest there. So there are strides in patient engagement and patient experience, right? This was a hot topic. And so as you can see from the poll, there's a lot of ambiguity around there, right? What are we using in our organization? Is it considered patient engagement? Is it considered patient satisfaction? And sometimes we're not even sure. So it was a panel discussion at HIMSS called the Patient Engagement and Experience Summit, which was bigger this year than last year. And in that panel, they were asked to rate their organization in terms of how readily or poorly organized they were in terms of patient engagement. And the SVP of Medical Affairs and Population Health at Lawrence General Hospital said, guess what? I think we're a 1.5 or 2 out of a scale from 1 to 10. And so there was agreement in that room that technology exists, right? We have apps, we have chat boxes, we have these patient portals that failed miserably, right? But we still have them out there. And many organizations are struggling to put a strategic plan in place, but not just a plan, something that really will work. And so just from a patient experience, dealing with healthcare in my family and personally, in order for us to be successful in the realm of patient engagement and patient satisfaction, especially when it comes to technology, we must put ourselves in the patient's shoes. We must build interactive apps and alerts. And the technology around patient engagement and patient satisfaction must be seamless. You know, everyone is busy. They don't want another app or another portal that they have to go to. So as much as we can build technology with alerts and, again, with the patient in mind, I cannot just preface that enough because we have to walk a mile in the patient's shoes. So this panel said, if you do have patient engagement focus groups or councils in your organizations, which we all should have by now, please include the patients and the family members. So again, they wanted to give this example also to vendors to say, as you're building this technology, please include patients and family members because these are the challenges that we've seen, right? Deploying technology in a meaningful way, achieving significant patient adoption. We saw that with the portals, right? Patients aren't going to the portals. It was like a checkbox for meaningful use. Marketing the value of the patient engagement tool. And when you're talking about marketing the value, it really has to be what's in it for me as a family member who have to take 4 of my elderly parents and grandparents to doctor's appointments and manage their health. It has to be valuable for me and really help me in my day-to-day. And last but not least, providing a compelling and satisfying user experience. Again, walk a mile in their shoes and make it simple and seamless. And so I was glad to see CMS really looking to really engage with this whole phenomenon of patient engagement. And CMS Administrator Seema Verma was there, and she launched the new My Health eData, right? And it was an initiative to get health data in the hands of the patients, right, and potentially their healthcare providers, right, their family members, and give those patients or their family members the power to send data to whomever they choose. Now, what I really like about this is it's very clever because it does start to address the interoperability issue we have from a policy perspective without the stick approach. So just pay attention to this patient engagement piece, and putting this data in the patient's hand is going to force us to be more aligned and interoperable in technology. So kudos to CMS for launching that. Now, diving into telehealth, this was huge this year at HIMSS. And you know, telehealth as a technology has been around for decades. And many organizations have been slow to embrace this because this is really a paradigm shift. But at HIMSS, they covered telehealth from all angles, from examining technological advances to reimbursement to care delivery models, the role in values-based healthcare, how do you implement, telehealth in a rural hospital setting, critical access setting, inpatient and outpatient setting. I went to one presentation, and it was held by one of the governors, and really from a legislative standpoint, they were talking about House bills and how they had realized personally telehealth was very effective for keeping their loved ones out of the hospital, and how they were going to ensure that the government is aligned with telehealth, and a lot about reimbursement. How are we going to get reimbursed for this? Again, as we dive further into telehealth, it was a quote that came out in one of the conversations that really stuck to me, and it says, how can we collectively shift care from traditional settings to everywhere outside of the 4 walls of healthcare facility to drive improved quality of care across the continuum? Again, this is a paradigm shift. And so we must collectively make this shift. Not just, we have telehealth in the outpatient settings, but we don't do it in the inpatient setting. We have telehealth in the home care setting, but the doctors or clinicians are not aligned in the inpatient setting. We must look at this from a continuum of care, holistic care, and from the patient's point of view. A patient see telehealth or view telehealth as access to care, especially from a critical or rural access standpoint. If they don't have the ability to get to the hospital, this could save a person's life and help them with health and well-being. So again, they urged us in the conversations at HIMSS to look at telehealth from the eyes or the lens of the patient. Also, a hot topic at HIMSS was mobility, right? And not just mobility to have a device, but mobility that's built for healthcare. So I saw a lot of nurses really focused on or centered around SpectraLink, who had just put out a new phone, Diversity, and Zebra TC51, and they're really looking for new smart devices that are healthcare grades, that are sleek, that are faster. Now, again, I've been at HIMSS, this is my 11th year at HIMSS, and I've seen the progression year to year. So you can imagine maybe 11 years ago, we were talking about computers in the rooms, and we were talking about computers mounted on the walls and having storages for them. Then 2 years later, we were talking about computers on wheels, and we were looking at the stations and what we call cows, and the chargers were in there and how light they were. And then it transitioned to now, how can we be mobile? So then 2 years after that, we talked about iPads and equipping nurses or nurse leaders with iPads, and then they had the tool belt of all the technology, right, of how to communicate. And the evolution of this technology is happening very, very much faster. So now we're talking about a computer in your hand, which is the cell phone. So we're focusing on mobility that improves the provider experience. So not just the nurse, right, at the bedside, but the physician or the nurse manager or the CNO in the hospital or the CMO, or even that cardiologist who's covering, who only comes to the hospital, every once in a while. But the things they were looking for is top-of-the-line cameras, right? So no more taking pictures on your own cell phone, right? We have to have HIPAA-grade, HIPAA-related pictures that are in line with our security measures that Dr. Mellon talked about. They were also looking at barcode scanners. So again, do we have a health-grade device that's not only has this computer in my hand, but it fits into my workflow where I can take pictures or I can do the barcoding administration. So no more of this computer on wheels with the barcoding, scanner and all these different applications. What we're talking about, mobility that's built for healthcare, is having all of that in one mobile device that at the end of the day will allow the clinicians to be at the bedside taking care of patients. Next top topic, and I'm so glad, and kudos to HIMSS for really doing a great job with this. So HIMSS 2018 coincided with International Women's Day, which was March 8th this year. And so Women in Health IT had a bigger presence and focus at the conference. And so it was great to see that there were 10 keynote speakers that were IT healthcare women leaders, multiple breakout sessions, roundtable panels. I mean, this year I attended the women networking event, the women's roundtable, the women's gala. So a lot focused on how can we build each other up, and not just build, woman to woman or peer to peer, but how can we focus on ensuring that we have women at the table, right? A lot of the showcase the technology that they helped develop. And so Vice Admiral Raquel Bono, who's shown here on this picture, was dynamic. She was a dynamic speaker and advocate for women in healthcare and women in healthcare IT. But she challenged each of us. She said, I want you to go back to your organizations, and I want you to take stock of the women that you have leading the healthcare or healthcare IT projects that you have around the table, that we're mentoring other women, that we're sponsoring other women at the table. So as I was tasked to go back and really take stock of that as a nurse executive in my organization, I want to also just put that out to you, that you go out and you look at your organization and make sure that we're sponsoring, we're promoting, we're mentoring, and we're ensuring that we have women at our table when we're talking not only about healthcare, but also healthcare IT. Interoperability. So the doors for greater interoperability have been opened. So again, I preface this with saying that Dr. Mellon said he's been at HIMSS for 17 years, and I've been there 11 years, and the word interoperability has been there every single year. This is one word, right, that does not go unnoticed. But what I am really excited about, and I have hope that this was the Interoperability Showcase was bigger and brighter and more aligned than I have ever seen. So there is more interest in fixing this problem instead of just talking about it. So it wasn't just a buzzword. It was really a show and tell of what's there today. And I think sometimes, because I don't think there's ever a stop to interoperability. So we think that, as much as it exists today, we think it's not really there, right, Dr. Ma? We think we don't have a lot today, but it is, and we saw that at the showcase. So major shifts from proprietary interfaces to standard HL7 interfaces support this interoperability. And again, speaking about the CMS initiative, right, the My Health data, I think, again, that's going to be out there to improve interoperability in health data exchange. So I think about, over the last 10 years, how have you seen interoperability evolve in your organization? As much as we say we don't have enough, and the EMRs is not interacting with the other EMR, and inpatient is really not given that much data with outpatient. But over the last 10 years, we have seen a huge advancement, and we can get a lot of data to take care of patients in a better way. And so I'm so proud of this slide right here, because you see two of our colleagues were there at the Interoperability Showcase, and they really focused on 3 key use cases: reinventing medication management, was very exciting, cardiovascular and diabetes risk, and transplant care. And they received the biggest reaction from demonstrating how we at Spok deliver alerts generated by the EMR, and we take those alerts and we deliver them or effectively manage them and give them to the provider. And you can see these slides here. There was a lot of interest there. And again, kudos to HIMSS, because the Interoperability Showcase was almost one complete huge floor. And so there were a lot of interest there and a lot of alignment. You see, Dr. Mellon talked about the partners. You see on this slide, GE, Philips, Spok, Zoll, a lot of partnership was there. And so I think this Interoperability Showcase will continue to get bigger every year. And so what's next, right? We're in the post-EHR era, and I think we can all agree to that, right? Because we have implemented our EHRs. You know, we may be ripping, replacing them, we may be optimizing them, but, you know, we're over the sticker shock, if you will, of the EHRs. And so now, what are we focused on? And so you see here the EHRs fell 6 spots to priority 8 on the 2018 HIMSS U.S. Leadership and Workforce Survey. So again, is that our primary focus? Some of the folks at HIMSS said no, not anymore. We're in the optimizing period. How do we make it better? Even though we know challenges still arise, right? But the attention has shifted from implementing EHRs to optimizing through new technologies and solutions. And so the technologies and solutions we're talking about is the next wave around healthcare communication platform, right, that complements the EHRs. So from AI and patient engagement, right, and also we saw revenue cycle huge there this year at HIMSS. So more around communication platforms that assist and complement the EHRs, but allow care teams to communicate through a mobile platform. And that's what we do here at Spok. And so in review, in essence, a very good conference, nothing really new, right, in terms of a big splash, but more on how we can leverage the technology, which I thought was good, right, because it's not always just a showcase to say, oh, this is new, this is the new burning platform, but now is the time to really take stock of our technologies today and say, how can we leverage them to provide better patient care, better value to our patients and families and their communities. And so again, in review, we talked a lot about interoperability, the cloud, partnerships, cybersecurity, telehealth, patient engagement, mobility, women in health IT, and the post-EHR era. And so I'm excited to see what will occur next year. And I look forward. Hopefully I'll be able to see you and meet you. You'll be able to stop by our booth and say hello to us next year at HIMSS18. Thank you.
Great. Thank you, Andrew and Shay, so much for that insightful presentation. We'll now take some time to answer your questions, and it looks like that we've had a few submitted already, but as a reminder, if you have a question, please submit it in the questions box, and we'll answer as many as time allows. So our first question is, did you hear a lot about artificial intelligence?
Yeah, so I'll take that one. I did. It was all over the place. I went to a talk about that and certainly many vendors and keynotes were talking about that too. And we are really at the nascent time with artificial intelligence and machine learning. We're looking at it to help with diagnoses. We're looking at it to help determine the right treatment patterns, looking at it for some complex diseases and cancers, to risk stratify people and to determine the right course of care. But we are still so early. And I think one of the most interesting comments I heard was from a gentleman who now runs a conference for artificial intelligence and in healthcare. And his comment was, look, what you really need to do is get some really smart clinicians together with really smart people who understand artificial intelligence, machine learning, statisticians, et cetera. Just put them in a room, let them brainstorm and figure stuff out, and great things will happen. I just thought that was really a great concept, to bring together these different disciplines and let them generate ideas and to think about ways to approach this in ways that we don't sort of think about normally. The other thing he said was that the U.S. is actually much further behind in the use of artificial intelligence than some other countries. He mentioned Singapore and China and UK, I think Netherlands. It's countries that have really embraced the concepts of artificial intelligence substantially more than the U.S. And some of the reasons he thought were it's because we do have such a fragmented health system here with a lot of regional and local variation and politics and different ways of purchasing, whereas in those other countries it's a much more centralized and tops-down approach to healthcare, and they're able to implement these kinds of tools in a more rapid way with faster adoption. So I certainly hope that in the U.S., where we do probably have, and actually we do have, the world-leading researchers and creators of the tools for artificial intelligence, we don't actually fall behind in the use of artificial intelligence to other countries who have different kinds of structures of their health systems.
Great, thank you, Andrew. Another attendee has asked, what HIMSS18 topic surprised you the most? And were there any topics that you were expecting to hear about but didn't?
I'll take that one. Well, I can't honestly say I was surprised by any topic. I think I was pleasantly maybe excited or surprised and really thought HIMSS did a great job with the Women in Health IT, really connecting that with the International Women's Day and the press or marketing or the alignment of women in health IT today that is out there. And so I think HIMSS did a great job of really intentionally putting women out there to do most of the keynote speeches or the sessions and having double the amount of women health IT activities. I was pleasantly surprised to see that, and I would hope that we would continue that wouldn't just be because it was International Women's Day, even though I think they did a good job of aligning that, but also it would be nice to continue that. It would also be nice to continue to have or start to have mentorship or sponsorship of maybe men and women who are new to health IT play a big role, because this is our future generation, and having them come to those conferences, because HIMSS do discount it a lot for students, but having students on panels maybe and having them do talks, again, I think we'll start to engage this next generation who would like to see themselves up there on that big stage. I think they could draw a bigger crowd with that, and also we're going to have to transfer our knowledge, right, from our generation to that next, and why not do it together?
Great, thank you. And we have time for one last question. So another attendee has asked, what would you say the general feeling or mood was at HIMSS18?
I'll start and take through the follow-up. I thought it was great. I mean, boy, it was super high energy. Where I was around our booth and in other areas was just hopping with people and great conversation. I'd say the thing that struck me the most this year was, we've gone through this cycle now of meaningful use and everyone being sucked into their EHR and implementing it and only talking about meaningful use and getting the money there. And what I really felt this year was, as Nate talked about, this post-EHR era, where now that people are sort of coming up from those years, coming up for air, they are innovating, they are pushing the limits in different areas. They're realizing sort of the boundaries of their EHR and understanding what they need to do beyond that. They're looking at these tools not as ways to simply automate processes, but to transform the way they provide care. So I thought the energy was great, and I just love having these conversations that are not simply about provider adoption, getting meaningful use dollars, the very basic things, but really about how do we use these tools to get to the next generation of care, the next way we engage patients, the next way we help physicians and clinicians, nurses, caregivers make better decisions, help keep the patient and family engaged. So I think it's a very exciting time, and I'm looking forward to seeing how this progresses and evolves over these next few years.
I would echo that, and also, IT and healthcare and how we leverage technology is about the whole senior team, right? It's about the care team, and not just the IT or CIO, and not just the CNIO or the director or the CMIO. It is about engaging the CMO and the CNO and the CIO and all of those leaders, right, at the C-suite. And what I saw, I think, different this year, that, again, added to that high energy is teams, complete teams of the CMO, the CMIO, the CNO, the IT director. And so it was great to see, again, this sea change of healthcare organizational leaders looking at this as a team sport, as a team approach. Not just I'm going to send my CIO or my IT director because it's IT. So, again, it was great to see that, because that shows that the healthcare organizations are thinking about these things different. And it also shows that HIMSS as an organization is doing a great job of engaging that level, right? Providing the keynotes and the speakers who are talking about patient engagement and not just the nuts and bolts of technology. The one plea I would say is it would be great to see some more of our CNOs and our CNIOs there as well, because nurses, 3.13 million nurses across the United States, are the backbone of our healthcare system. So to see them there was great. It would be nice to see some more of our CNOs.
Great, thank you. And unfortunately, we are out of time today, so this concludes today's webinar. If we were unable to get to your question today, we will be sure to follow up with you. If you'd like to chat with a Spok representative on the topics that we discussed today, you can do so using the link in the chat box. You can also continue the conversation with fellow attendees by using the hashtag SpokWebinar on Twitter. Follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spok, as well as industry news and trends. Thank you all so much for joining us. We hope that you enjoyed this webinar. Have a great rest of your day.